Hello, everyone. I am Dr. Steve Johnson, and I want to welcome you to this YouTube live presentation on nicotine addiction, where I'll be looking at some causes, diagnosis, and treatments. It'll be rather condensed presentation, but this is just one in a long series of those on numerous topics. If people can't get on here or just to prepare for the future, just know that I do post these on the YouTube channel, ReBT Education and Programs, right? Or Training, ReBT Education and Training. It's the same name that we have for the Facebook page, okay? So it's easier if you get on the YouTube channel and just subscribe to that, because then you'll get notification of all kinds of such programs. Okay, so welcome. I think so many of you who wrote to me last time. And I do want to remind you that tomorrow, if you're taking the addictions course, the free addictions class, I do have live question and answers tomorrow at 10 o'clock on YouTube Live. So let's jump into nicotine addiction. First, I would like to kind of look at the epidemiology of it. It is amazing that nicotine addiction is the second leading cause of death internationally, the second leading cause. So we're really talking about a huge number of people addicted to nicotine, despite the really deleterious health effects. The causes of death from smoking are 1, atherosclerosis, 2, cancers, primarily lung cancer, but a huge array of other cancers that I may not have time to mention in this particular lecture, but it's just a numerous systems of the body. Lung cancer, 90% of all lung cancers are due to smoking. COPD, the chronic obstructive pulmonary disorder, directly caused by smoking, and prenatal mortality, the unfortunate deaths there. Not only is it a direct cause of those conditions, but it also contributes to the negative effects of other conditions, such as sleep apnea, which can cause more problems than people generally are aware of. Low birth weight if the mother smokes, cataracts of the eyes, pneumonia, and actually even some forms of leukemia have been linked to nicotine addiction. If someone smokes long term, in addition to those deleterious effects that I've already mentioned, there are other negative consequences, such as even the body's appearance. It does cause aging that shows in the face with more wrinkles, etc. It's been linked to infertility or impotence, susceptibility to colds and the flu and all those kinds of things. Diabetes impairs the senses, such as it makes it more difficult. It mutes the taste and smell. So, that's unfortunate because we want to enjoy our food and etc. So, and then the other thing is that it really does negatively impact the health of those around us, our loved ones and friends and coworkers, if they permit smoking where you work. It's estimated that about 50,000 individuals in the United States alone die each year from secondhand smoking alone. Worldwide, there are about 1.3 million individuals who smoke. In fact, 84% of all smokers are in developing countries, which is very unfortunate. It contributes to over 500,000 premature deaths every year. So we can see this is a huge problem. And if we look at how it impacts even our young people, like high school age kids, we have found that while smoking over the past few years is down, marijuana smoking has gone up. 17% of all high school seniors are smoking cigarettes, whereas 23% of them are using marijuana. And hookah smoking is up. In fact, nearly 20% of high school seniors have smoked a hookah within the past year. So let's shift to what are the causes? What are the causes for nicotine addiction? I mean, with knowledge about all of these potential very deleterious consequences of using nicotine and smoking, what causes it? Well, like any addiction and like all addictions, it's very, very complicated. There are numerous reasons why people begin smoking, why they continue to smoke, why they try to stop smoking, and why they fail often repeatedly at staying off smoking, and they resume smoking again. Part of it is there are perceived benefits from smoking. One, nicotine is rather interesting because it can act as a depressant and a stimulant, which really relatively rare for a substance. But it acts as a depressant in the sense that it does lower anxiety in some individuals, but it acts as a stimulant because it physiologically arouses an individual. So often, someone who's addicted to smoking wants to have that cigarette, when they get up early in the morning. And frequently, then it acts as a stimulant. And often individuals have that first cigarette with a cup of coffee. So not only are they getting nicotine, but they're getting caffeine. So they're getting rather physiologically aroused there. Why is it so addictive? Well, smoking, the nicotine, raises the dopamine within the body, and dopamine stimulates the reward and pleasure center of the brain, specifically the nucleus accumbens, which contributes to the addiction. Also, when the dopamine levels go down, when someone hasn't smoked for a while, then the craving kicks in because of the addiction and the craving for more dopamine in the body. So, if those are kind of the causes, why do some people end up addicted to nicotine and others don't, even though they may both have tried smoking? It's an excellent question. And we found in research that there are certain people who are more at risk at becoming addicted to nicotine. Two important issues. One is the age at which you begin smoking, and the other one is whether or not one or more of your parents are smoking. So what we know is that you are at greater risk if your parents smoke, one or more of your parents smoke. In fact, if one or more smokes, then your risk of developing a nicotine addiction goes up 2 times greater, okay? If your friends smoke, also there may be a genetic component to smoking. There may be a genetic predisposition to become addicted to nicotine. Also, if you experience any kind of mood or mental or emotional disorder, especially mood disorders, that would be major depressive disorder, a prolonged depression, or even bipolar disorder will predispose you to become addicted to smoking, as well as schizophrenia can do the same. Another area is substance use disorder. A large number of individuals with substance use disorders also smoke, and often that includes using or abusing alcohol. The factors, so those people are at greater risk. The factors that seem to be most present to predispose an individual to begin smoking are, one, stress. So we know one of the ways that we're going to try to treat it is to help individuals lower stress. But also individuals who have poor self-esteem, or in ReBT, we would say lack unconditional self-acceptance, right? They tend to put themselves down have a low view of themselves, a low opinion of themselves, are more predisposed to it. Also, if there are there can be social reasons like parents smoke, friends smoke, and even that whole hookah scene, the hookah bars, largely young people in there, so there's a social component to that too. And then if you've been exposed to advertising about tobacco, there's a greater likelihood. In the United States, it's been illegal to do that in the media for a long time, but there are other ways to get that out. And I noticed when I was overseas that sometimes they were a bit freer about advertising smoking publicly. So that unfortunate, but those are contributing factors. The profile of those who are most likely to be smoking is one, males tend to smoke more often than females. When females do, they tend to try to use things that have less nicotine in it than the males do, and they tend not to smoke as often as males. Caucasians tend to smoke more than African Americans, Latino community, and all of those. However, some research has suggested that if an individual is multi-ethnic, that there's a greater predisposition to smoke too. If an individual has no plans for college, they're greater at risk. And if someone has parents who are not educated, have high levels of education, so there is some suggestion that there may be some socioeconomic contributing factors to smoking. And if an individual has undergone early childhood events, the adverse childhood events, the ACEs score, they may be greater to be at risk to develop a nicotine addiction later in life, particularly if they've experienced abuse or neglect. If their parents divorced, there's a greater likelihood. If one of the parents was mentally or emotionally ill, or a parent was incarcerated, all of these are really stressful events. And so we've seen that stress is a contributing factor. So that's not surprising. So, okay, we have a lot of facts about the effects, the causes, and who's at risk. But how do we actually diagnose this? And here we tend to go to the DSM-5. One thing that we have to see is a problematical use of tobacco that impacts us in negative ways. Maybe it causes some kind of impairment in some area of life, personally, interpersonally, occupationally, education, and maybe even spiritually, if it has a negative effect on you there. Or we see a distress as a result of smoking. If someone is really distressed about it too, then there can be a substance use disorder that is nicotine in nature. We want to see at least two of the following factors too. One is that over time that they need to use more and more tobacco, smoke more and more to get the same desired effect. They have this ongoing desire to cut down. They spend a lot of time in smoking related activities, going and buying it, looking for places where they can smoke, and all of those kind of related activities. If they crave smoking whenever, after they've gone an amount of time without doing it, if it begins to interfere with other areas of life, and maybe it interferes with you socially because some friends don't want to be around you when you're smoking, or people get upset with you if you stand outside a building and smoke, because when they walk out, then they smell the smoke, or if they have asthma, then it contributes to difficulty breathing for them. If an individual continues to smoke, knowing that they are experiencing negative effects, we see TV commercials in the United States where somebody has, a cancer of the throat, they're on oxygen and they're going to be dying of the cancer, and they're putting the cigarettes to, up to a hole in their throat to try to get that nicotine in there. So clearly they were out of control there. If they replace other activities, so that they may smoke instead of going to exercise, they may smoke instead of going to movies, etc., because they don't want to interrupt their smoking, right? if they smoke in hazardous conditions, if they're smoking around oxygen, if they're smoking around, people who are really, really sick, etc. So those are hazardous conditions. And if they continue to smoke, knowing and they're educated, they know the negative consequences, but they continue to do so. Or if they've experienced tolerance, and that is the amount needed to reach the desired effect, they have to continue the amount of smoking to get that desired effect. And then also to experience withdrawal. And withdrawal is evidenced by several things. One, it often at the top of the list is irritability when they're trying to stop smoking. Irritability, anxiety, even difficulty concentrating can be there. Increased appetite. In fact, a lot of people don't want to give up smoking because they're worried that they're going to gain weight when they give up the smoking. Restlessness, depression, and it really can negatively impact someone smoking and cause insomnia. So what do we do? It's very straightforward to diagnose it. It's not a mystery at all. Those symptoms are quite easy. So we know generally what the causes are. We know what the effects are. We know why individuals tend to smoke, why they're motivated to smoke, what those conditions are, personal and social reasons. Now, what do we do to help them? And that's the part that I'm really, really interested in. And so I want to mention, we don't have time today to go into great detail on these, but one of the things we want to do is to look at evidence-based treatments. That is, treatments for which research has been conducted and these interventions have been shown to be effective for a good or a significant number of individuals. One thing that has been found to be most helpful in the treatment of individuals addicted to nicotine is that we use a multimodal approach, okay? And so let's look at what those different approaches might be so that they can be combined and to help the individual get off the smoking. And sometimes it's no one person that will be able to help them. So it may be multiple professionals, groups, individuals, et cetera, who can help individuals do that. So if we group them, it could be one approach would be psychotherapy, another one would be a medication, and then another one would be support. Let's take a look at psychotherapy first. So many of you will be psychotherapists. There are several things that really need to go into therapy with someone with a nicotine addiction, and that is we need to help them learn how to address high-risk situations. What would be a high-risk situation? Well, first thing in the morning when they're having the craving for the cigarette, maybe at a break during work time, or immediately after work as part of unwinding, or if they go to a bar and they tend to smoke when they're there, or after they've eaten, right, or before they go to bed. So we need to look, or they're around people who are smoking. So we need to help them in high risk situations. Well, there are several things you can do to help them with high risk situations. One is to say, try to stay away from that. But that's going to be very difficult for some situations, like you wake up in the morning and you have the craving, right? And you have to wake up, and so the craving is there. So I don't know that you can avoid that situation, but what we might want to do is to replace the behavior with another behavior. But we need to replace it with a rewarding behavior. Otherwise, the craving may still be there. Okay. The other thing is to look at the beliefs the individual has when they begin to crave. Okay. Or when they're in a particular situation, I need this to unwind. So a demand they put on themselves, which is really, really unhelpful to to do. So numerous kinds of beliefs can contribute to it. Or when they're withdrawing, they may go, I can't stand this. This is awful. This is too much. All of those kinds of beliefs will not help them to get off of smoking. Another thing is support and encouragement. That can be done in a group. And there's another factor when we look at support and encouragement, because a good number of individuals who smoke, not all, and we can't make gross generalizations here, but a good number of people who smoke when they're really lonely or they're experiencing loneliness. For example, during COVID has been a very difficult situation for people, especially people with addictions. And so their craving has gone up because there's the dopamine that they would get by interacting with other human beings often isn't there as much. And so there's loneliness. And so we know a good deal about what helps individuals overcome loneliness. Where Cigna Insurance Company did some research. It was rather fascinating. And they looked at 3 different models for helping individuals with loneliness. And one model was to give people social skills training. And they found that while that's somewhat helpful, it was not terribly helpful, and we'll see why in a minute. A second model was to give people recommendations for how they could connect with people. And then the third was to change dysfunctional beliefs. They found that individuals in that first group, where they thought that they should give them social skills training, lo and behold, the research found that most people who experienced loneliness and maybe smoking did not lack social skills. They had the social skills. They weren't using them because they were isolating, okay? But they had the ability to use social skills. So social skills training wouldn't have been terribly helpful for most individuals. The other one is to have opportunities. Well, that was helpful to find out about ways in which individuals could connect with other people. But it was also found that even if there were opportunities to connect for people who were lonely, they often didn't use those opportunities because they had beliefs that weren't helpful, that prevented them from capitalizing on those opportunities. For example, they would say, oh, it's not going to help. No one's going to like me. People don't care. So you see, those kinds of inferences and beliefs don't really help people take positive steps to get the support and encouragement that they may need to overcome the loneliness. So if we look at how to help people change those beliefs, then those models that can do that would be very, very helpful. And some of those would be like CBT, ReBT, et cetera, that will try to change dysfunctional emotions and replace them with more functional emotions, okay? One of the things I think that is very helpful when we look at what tends to work in treating an individual with a nicotine addiction is to use the ABC model in ReBT. One thing that we need to do when we're treating is look at precipitating events. What are events in which the individual who does not want to smoke begins to smoke? Becoming aware of that activating event is tremendously, tremendously important. Also, and I'm going to come back to that in just a minute. Another thing that we can do is to develop alternatives to the smoking. For example, exercise, engage in hobbies, and all those kinds of things. Now, those alone will probably not do it, but we're talking about a multimodal approach here. So we're trying to give multiple things for these individuals to be able to do. Of course, to create a social support network would be really important, and some time and effort into that and supporting a client do that would be very, very important. But really important is to help an individual with negative or dysfunctional self-talk. And we do that in ReBT through a process we call cognitive restructuring. And cognitive restructuring involves, one, identifying those beliefs that an individual has about a precipitating event. So for example, they're around people who are smoking. Being around those individuals may be a precipitating event for them. And so they would have beliefs. I need a cigarette, which is a demand, okay? It's awful not to smoke when I'm surrounded by smokers, right? So those would be some of the beliefs. And so we would identify them. Secondly, we would help challenge those beliefs. If you tell yourself that you absolutely have to smoke, how is that helpful for you in the attainment of your goal not to smoke? If you tell yourself you absolutely have to smoke. And so we're not arguing with them. We're just trying to help them see the dysfunctionality of holding that belief, because it doesn't help them reach their desired goal. And then the third part is to replace that belief with another belief. Yes, it is uncomfortable when I'm around people who are smoking, but it is not impossible to deal with, right? It's really uncomfortable. I don't like it. I wish I didn't have this situation, but it is, and I can deal with it. Much more functional belief. And we do this for all the dysfunctional beliefs that we identify that would contribute toward the individual smoking when they have the goal not to smoke. And then what we have them practice is acting upon the belief. So for example, I might say to my client, why don't you act as though you weren't craving? If you weren't craving and had those demands that you shouldn't be craving this and that it's intolerable, how would you act? What would you do? And so instead of waiting for the feeling and for waiting for the belief to change, act upon the good belief, because sometimes it's easier to act your way into an emotion than to wait for the emotion to come around before you act upon it. So act first, and then often, because the emotions and behaviors and beliefs are interconnected, a change in one causes change in the other. So sometimes changing the behavior can change the belief and change the emotions, okay? So that would be the whole cognitive restructuring process. So please take a look at any of the ReBT workshops, etc., where they're covering that ABC model. On this YouTube channel, you will find numerous kinds of videos that really, for absolutely free, that will go over that ABC model to help you out, okay? And then, of course, we saw that for a good number of people, one of the contributing factors to begin smoking was stress. So we can help them lower the stress. We're going to do all those other things too, but we also can help them lower the stress. One of those is, of course, the cognitive restructuring that we just talked about. It is one really good way to help lower stress. But they could also do diaphragmatic breathing. They could do progressive muscle relaxation, yoga, Tai Chi, guided imagery, mindfulness techniques, and even repetitive prayer. All of those really helpful ways to do that. I actually did, and I'm doing a series of 3 videos on how to decrease stress. 2 of them are already published, and they're on the ReBT education and training YouTube channel. So please take a look at those 2, because those can be used for an individual who's suffering an addiction to nicotine. One excellent model. I highly encourage anybody who's working in the addictions field, in addition to the CBT, ReBT, etc., integrate motivational interviewing. And so there are some great videos and continuing education units, programs to look at motivational interviewing. I highly recommend that you take a look at that model. I don't have time to go into it today, but what I love about this is that it works with people at different stages of readiness to give up an addiction, right? To change behavior. And they work with them at each of those levels in slightly different ways, not to tell them exactly what to do, but to tap into those proclivities within them that want to move toward a life free from those addictions in very, very helpful ways. I highly, highly recommend it. If you're taking the free addiction class, the theories of addiction, in I think 2 or 3 weeks, maybe a little longer, I will be looking specifically at motivational interviewing and trans theoretical models for helping an individual with an addiction change. So I highly recommend that you, there's a playlist on ReBT education and training. I have a playlist just for that addictions course. And so if you don't want to look at anything else, if you go there, you can look through the videos in the playlist, and we add about 2 every week as I go through the course. The other thing is to remember, use a combination of interventions, because we never know which combination is going to work. I want to briefly talk about medication. I'm not an MD, so I don't prescribe, but I will be relating to you what's in the literature. There is one approach, one medication approach, which is called nicotine replacement therapy. And that is they give lower levels of nicotine to individuals to help them in lowering the frequency, intensity, and duration of their smoking. And those could be like nicotine patches. In the United States, we have to go to, I think if you have a pharmacy or something, to get the nicotine patches, nicotine gum, lozenges, inhalers, etc. They come in several different forms. There are also non-replacement therapies, non-replacement medications that are used. One is Chantix, a certain medication that interferes with the receptors in the brain that attach to nicotine, so that if you take Chantix and you smoke, it reduces the amount of pleasure that you get from the smoke. And remember, that's a huge component, because the smoking raises the dopamine, which triggers the nucleus accumbens, which is the pleasure and reward center. But if we decrease the amount of pleasure, then the propensity to smoke is decreased. Clonidine, which is a high blood pressure med, is often used, but more as after they've tried everything else out, then they may do that one. Antidepressants, excuse me. Antidepressants have proven helpful for a number of individuals, and specifically those antidepressants that elevate dopamine, which makes sense, right? Dopamine and norepinephrine. And one of the antidepressants that does that is Wellbutrin. So often it's not uncommon to prescribe Wellbutrin. Okay. So let me sum this up by saying, overcoming nicotine addiction is difficult. Let's not pretend that it's an easy state of affairs. But the good thing is we're living in a time when we have multimodal kinds of therapy, multimodal approaches to this that gives us hope that we, and we've covered some of those techniques, that if we use these diversity of techniques or some combination of them, we can decrease the difficulty somewhat of an individual getting off that addiction, right? And if you or someone you know is having great difficulty getting over a nicotine addiction, you can always seek professional mental health help, someone who deals with addictions and can help you with that. There can be a psychiatrist, psychologist, master's level therapist, addiction therapist, for example, and or your physician, because the medications, you would need the physicians, right? Which also would include the psychiatrist. I thank you all so much. I hope you join us tomorrow if you're in the addiction class, the theories of addiction class, because I'm going to be answering some of the questions. And probably this week we'll be posting the next one. But thank you guys so much. And I'm really happy to see more and more people interested in helping our individuals overcome this really nasty addiction. Have a wonderful day. Bye-bye.